and our moderator will help post the questions to our panelists as well. And if you are watching on Facebook Live, you can also post your questions in the comments section as well. All right, we shall begin right now for our session 1 in poverty and nutrition. Now, this session discusses the progress and contemporary challenges of SDG 1 and SDG 2. The discussion considers the impact of the COVID-19 pandemic on Malaysian society and the collective ways to address poverty. Now, what are the contemporary challenges and how can we readdress concerns? This topic is analyzed in Chapter 2 of SDG 1 and SDG 2 of the VNR report. And today we have our moderator that will introduce all our panel speakers from the government, parliamentarian, civil society and think tank sectors as well. She's an adjunct professor of UTM and senior fellow of MASA. I shall hand the microphone over to Dr. Habibah Abdul Rahim. Over to you.
Thank you, Mr. Shahrizan. Assalamualaikum, a very good morning, ladies and gentlemen. This session is focused on Chapter 2 of the VNR Report 2021, Poverty and Nutrition, which covers SDG 1 and SDG 2. The VNR report highlights that significant achievements have been made in eradicating poverty and narrowing inequalities, as well as providing better quality of life for the people. Nevertheless, there remains pockets that are disadvantaged among selected groups and regions, as well as multi-dimensional deprivations. In addition, the situation brought about by the COVID-19 pandemic has been seen to reverse some of the gains made and worsened existing social and economic inequalities. To provide a critical review of the 2021 VNR report, we are fortunate to have 4 prominent speakers. They are selected to represent and provide different perspectives of the topic. Representing the government, we have Dato' Herman Abdul Hamid, Deputy Director, Equity Development Division, Economic Planning Unit. Parliamentarian Yang Berhormat Tuan William Leong, Secretary of the All-Party Parliamentary Group Malaysia on SDG and Member of Parliament Selayang. Representing the civil society, Dr. Lin Hui Kiang from the Society for the Promotion of Human Rights, and think tank, Professor Dr. Sulochana Nair, Vice Chancellor, Binary University. Is given 10 minutes. Please focus on the topic of poverty and nutrition of the 2021 VNR report with an emphasis on the way forward. We will have a Q&A session at the end of the review by all speakers. Speakers may also respond to the question posed in the chat box or if in Facebook, in the comments. Without further ado, I call upon Dato' Herman Abdul Hamid to begin the session.
Thank you, Madam Moderator. Assalamualaikum, salam sejahtera and a very good morning. Yang berhormat, yang berbahagia, Tan Sri, Datuk Sri, Datuk, distinguished panel members, respected participants, ladies and gentlemen. Thank you, Datuk Habibah, the moderator. Firstly, I would like to commend FPPGM and Institute MASA for convening this consultation on Malaysia's second voluntary national review report 2021, which is timely. And I am indeed honored to be a panel speaker together with other distinguished panel members representing parliamentarian, civil society, and also the think tank academicians. And ladies and gentlemen, my presentation in session 1 will cover poverty and nutrition under the SDG 1 and poverty, and SDG 2 zero hunger. And this presentation is a continuation of the keynote address by the YB Minister, and also the introduction of the VNR by the Deputy DG of EPU just now. And consequently, this presentation reflects the Chapter 2 of the VNR report itself. Ladies and gentlemen, before moving further, allow me just to share that poverty eradication is one of the socio-economic agenda for each Malaysia plan, and also the Malaysia development policies, starting with national economic policy and to the current two shared prosperity vision. It's guided by growth with equity and inclusivity principle in leaving no one behind. So the 11 Malaysia plan continued the agenda to eradicate poverty at SDG 1, SDG 2, and also addressing poverty and inequality in leaving no one left behind will be further addressed in the 12th Malaysia Plan in line with SPV 2030 and also the Agenda 2030. As for the current status and progress of SDG 1, Malaysia has managed to reduce poverty, where the absolute poverty rate measured in the using the national poverty line income dropped from 49.3% in 1970 to 16.5% in 1990 and further reduced to 0.2% in 2021. Meanwhile, the incidence of household living below international poverty line of US $1.9 per day is almost eradicated at 0.5% in 2019 from 0.3% in 2016. As for improving poverty measurement, the incidence of absolute poverty decreased from 7.6% in 2016 to 5% in 2019. This is using the 2019 PLI methodology, and the hardcore poverty also decreased from 0.6% in 2016 to 0.4% in 2019. As for the multidimensional poverty, MPI improved from 1.5% in 2016 to 1.1% in 2019, or 0.011 points. In terms of inclusive growth, poverty rates across strata and ethnic groups have improved, with the biggest reduction poverty experienced by Bumiputra, and then the poverty rate significantly reduced from 65% in 1970 to 7.2% in 2019. As a result, the number of poor households declined from 525,000 to almost 400,000 in 2019. Okay, as for the government assistance, the 11 Malaysia Plan has implemented various programs and initiatives to enhance inclusivity, especially for B40 and M40. And if you look at the, in 2019 and 2020, almost 10 billion were given to 8 million recipients, which were part of the B40 cash transfer. And arising from COVID-19 pandemic, almost 18 billion were rolled out to B40 and M40. That benefited 18 million recipients through various government stimulus package, right from Prihatin, Pemberkasa, and also Pemulih. Okay, next. There are several issues and challenges in relation to achieve SDG targets. Firstly, on the absolute poverty, although the incidence of absolute poverty decreased from 0.6% in 2016 to 5.6% in 2019. However, the pockets of poverty exist, and it's concentrated in rural areas, in Sabah, Kelantan, among orang asli, and children, and also the elderly. Secondly, the incidence of relative poverty reduced from 15.9% in 2016 to 16.9% in 2019. However, relative poverty are higher in developed states such as Selangor, Penang, and Kuala Lumpur. And relative poverty also higher among female-headed households, the elderly, employees, and among Bumiputra household. Third issue would be on the social protection in Malaysia. It's broad. yet it's fragmented and less coordinated. And furthermore, the government spending on social protection is 6.2% of GDP, which is lower if we compare with the global average and OECD at 8.6% and 21% respectively. So moving forward, next slide, please. Moving forward, the government under the whole of nation approach, under the SDG will, number one, review the multidimensional poverty index. As we look at now, the current MPI measurement are no longer relevant for upper middle income country such Malaysia. The MPI dimension and indicators such as standard of living and health will be reviewed in the 12th Malaysia Plan, and this include to introduce access to internet and digital device, where currently is only on the having telecommunication or fixed lines telephone. Secondly, to reform Malaysia's social protection and social security system, where at the moment social protection coverage is low among the working age adults, and the private sector employees are obliged to social security, but for the self-employed, they are not covered. So this will provide opportunity to expand social security coverage to all adults, working adults. Thirdly, to strengthen social assistance, especially for the vulnerable groups such as the poor, children, and elderly person with disabilities. This is include mapping social assistance and to the targeted groups needed to avoid duplication, and also strengthening social assistance for the vulnerable group to enhance integrated data, pangkalan data perlindungan sosial, which is under the My Social Protection Council. And then this initiative includes enhancing social protection, poverty eradication, provision of house, quality education and health, and also improving service delivery. Next. Like this. Now we move to the SDG 2. Let me just share the current status of SDG 2, which is zero hunger. Despite Malaysia's effort in achieving SDG 2 targets, the prevalence of underweight among children, which is 14.1%, and stunting 21.8%, wasting 7.9%, and anemia among women about 29% in 2019 have increased. But on the positive note, the prevalence of overweight among children has decreased to 5% in 2019 from 7.1% in 2016. On improving national nutritional program, the implementation of 1,000 days of life program, this is equivalent to 12 and 12.5 years of age, to improve nutritional status for children has been strengthened. In addition, rehabilitation program for the malnourished children and also community feeding program for children of the indigenous community, orang asli, were undertaken. And in strengthening food and national security and nutrition security, the government has launched the National Agro-Food Policy, and subsequently, due to concern of the impact of COVID-19 on national food security, a cabinet committee on national food security was set up in March 2020, among others, to further formulate and discuss national agro-food policy moving forward. And in efforts to improve the state of malnutrition, the government has recently reviewed the national nutrition policy of Malaysia, as well as national action of nutrition in Malaysia. And next slide. There are several issues and challenges in relation to achieve SDG 2 targets. Among the issues, firstly, the double burden of malnutrition. and a rise in non-communicable disease, where different prevalence indicators of stunting and the weights between location and ethnic groups occurs. And in addition to that, there are different risks of NCDs between genders. Secondly, on the issue of malnutrition, major contributing factor to this include lack of expenditure on agriculture research and development, and also lack of dependency, lack of infrastructure, and as well as dependency on import of food there. The other issue would be the availability of national food, where it remains a challenge, where Malaysia's food import bill has risen by annual average of 6.5% from 11 billion in 2000 to 51.4 billion in 2019. So this is very challenging for us. And then the impact of COVID-19 prevents the delivery of the implementation of initiative on the nutritional food. Okay, next slide, please. On moving forward, the government, together with all the stakeholders under the whole of nation approach, will address stunting and malnutrition through national nutrition policies. This is where the government are committed to address stunting and malnutrition, particularly the provision of household food security, quality health services, healthy environment, and adequate care and feeding practices. Secondly, to enhance food security by formulating a new national agro-food policy and an action plan. This is currently being formulated by the Food Security Cabinet Committee. The targeted outcome include to reduce national dependence on food imports, stable food prices, healthier eating habits, sustainable food production, as well as increasing private sector's role in involvement in strengthening the food system, and to continue assess and monitor the nutritional outcomes in order to achieve the necessary targets. Okay, next slide. Okay, that's all for the SDG 1 and 2. Thank you, ladies and gentlemen, for your attentive listening, and then we shall be able to answer any question during the Q&A. Thank you.
Thank you very much, Datuk Herman. If we can quickly move on to our next speaker, YB Tuan William Leong, the floor is yours.
Sorry, unmuting myself just now. Thank you very much. I'm pleased to share my thoughts on Malaysia VNR 2021 on poverty and nutrition. I wish to congratulate the government on its fine efforts in producing the second VNR, which will form the base for the alignment of SDG with the nation's development under the 12th Malaysia Plan. My first question is with regard to whether we are using the correct PLI. I wish to refer to the first paragraph under the heading Status and Progress at page 40. The most remarkable achievements made were in poverty reduction and shared prosperity. The absolute poverty rate measured using the National Poverty Line income dropped from 49.3% in 1970 to 16.5% in 1989, and further reduced to 0.2% in 2019. Dr. Herman just referred to this just now. The point is that with a 0.2 poverty rate, this means Malaysia has substantially eradicated poverty in 2019. This is even before the target date of SDG 1. We know this is not true. So the poverty line income becomes very important. The previous PLI of 980 ringgit was heavily criticized as being too low. The question to be asked is whether the new PLI of 2,208 ringgit is correct, or should the PLI, at least for urban areas, be raised to 3,280, being half of the urban median income of 6,561. The issue is that an incorrect PLI causes harmful effects. What is needed is a realistic poverty line income that captures the deprivation and vulnerabilities of the poor. The question is really not how much the poverty line income should be. The question is, who are the poor? How did they become poor? What needs to be done to get them out from being poor? The problem is when we get too caught up with measurements, we forget that the primary objective is to solve the poverty problem on the ground, not on paper. This happens when we allow the means to obscure the ends. When we try to fit the incidence of poverty into the measurements, when we should be using the measurements that correctly fit the incidence of poverty. So in thinking about the question of the correct PLI, it may be worthwhile to recall the comments of the UN Special Reporter, Mr. Philip Alston. He referred to the harmful effects of using the wrong PLI. The government has since adjusted the PLI, but his comments about the harm of a wrong PLI remains valid. By denying the existence of poverty or by minimizing the problem, it has encouraged underinvestment in poverty reduction, caused widespread misunderstanding of who is poor, and has led to bad policy making. Therefore, having a correct PLI is of urgent priority. The use of relative poverty and multidimensional poverty index is a better approach, and we would like to see that this is done more towards considering the policy intervention that is needed than to use a strict PLI. And this is also encouraged under the SDG indicator 1.2.2 for the use of a multidimensional index. This would allow comparison to be made between countries and to be a better guide for the monitoring of progress, not only for SDG 1, but for the other 16 SDGs. The issue is that urban poverty is now a national emergency. It is the new phase of poverty, and it must be recognized that it is a different phase from rural poverty. It must be recognized as such and be dealt with according to its peculiar needs. So the previous narratives no longer holds water. We have been told that poverty has been eradicated and that there are only isolated pockets of poverty among the indigenous people and the rural areas. But poverty has been staring at us in the urban areas all the while, except that it has not been acknowledged. Urban poverty needs urgent intervention. The COVID-19 pandemic has shown this. COVID-19 has shown that poverty is race blind and affects migrants, refugees, citizens and non-citizens, stateless people, and it bounced back to us that you cannot contain the COVID-19 pandemic because there are people that are left outside. So people who until now are not captured by the official statistics, they are invisible. So for the purpose of official statistic reporting on the success of reducing poverty, they do not exist. If we are really going to leave no one in Malaysia behind, then the invisible man must be recognized. My second point refers to social inclusivity. The opening sentence in chapter 2 of the report is correct that inclusivity is the key principle in Malaysia's development. However, after more than half a century of the NEP, and was also a question asked in the first session, we see that unity remains very much a work in progress. In fact, we are more polarized and we are further apart than before. We must acknowledge that being wealthy or living in poverty is not due to our DNA. Race is a social construct. It is important that we deal squarely with the fact that poverty is due to socio-economic conditions in order to eradicate poverty. It has got nothing to do with our DNA. The government should institute reforms to ensure that the needs of all people living in poverty are comprehensively addressed. This will in turn benefit the country as a whole. We must stop after 60 years of independence of looking at poverty and wealth using the lenses of the colonial, that it is the racial inequalities along racial lines and ethnicity, which unfortunately until today still pervades in how many people think and talk about poverty. It is important for the government to proceed on the basis that poverty eradication programs must be for all races and all religions. Poverty eradication program must reflect that poverty affects all races and all ethnicities. All affected are entitled and must be helped to get out of the vicious circle of poverty and move up the virtuous circle of prosperity. I will now move to SDG 2, Zero Hunger, and it has been acknowledged in the VNR, the issue of the prevalence of stunting and the underweight of children and of the pregnant mothers who are suffering from anemia. This is a serious problem, and this has been shown in the UNICEF study of child poverty in Kuala Lumpur, where low-cost flats reported that 22% of the children below the age of 5 are stunted, 15% are underweight, 23% are either overweight or obese, 4 in 10 households have no toys and no children's book. They have no conducive place to study, and their surrounding environment is unsafe. While almost all children 7 to 17 are in school, only 1 out of 2 of those aged 5 and 6 are in preschool. More than 1 in 10 children have less than 3 meals a day. 97% of the households say that high food prices prevent them from preparing healthy meals for their children. 1 in 2 do not have enough food to buy food in recent months, and 15% experience this frequently. Adjusted for household size, the relative poverty rate of these children is almost 100%. And this is before COVID-19. We all know those who have the least before COVID-19 are now struggling to survive with even less. So the UNICEF study highlights that urban child poverty and malnutrition is an emerging national disaster. There is an urgency for policy intervention to ensure children in poor urban settings are included in wider urban opportunities. Malnutrition and preschool education require urgent intervention policies. I will conclude here. I am pleased to have the opportunity to share my thoughts on the VNR 2021. It is going to be an exciting journey with SDGs providing new milestones. I look forward to all parties contributing and making the SDGs become a reality so that we in Malaysia can say in one voice that no one is left behind. Thank you.
Thank you very much, YB Tuan William Long. I would like to now call upon Dr. Lin Mui Kiang. The floor is yours.
Thank you. Thank you, Datuk Habibah. Good morning, Tan Sri, Sulaiman Mabok, YB, ladies and gentlemen. Today, with the pandemic, it has reversed some of Malaysia's gains in poverty reduction. It has increased from 5.6% in 2019 to 8.4% in 2020, and is expected to increase further this year. In 2020, the monthly median wages dropped 15.6%, while average wages dropped 9%. This affects 63% of the 15 million in the labor force. 91% of retail businesses suffered decline and have laid off 50,000 workers, and 30% of shops at malls have closed and laid off 300,000 workers. 100,000 SMEs have ceased operations since the first MCO, another 50,000 during the third MCO. And the majority are micro SMEs, which make up about 80% of the closures during the MCO. and 71% during the RMCO. And the majority have yet to receive government assistance. And challenges are more pronounced for the B40 households, urban and rural. For women, children, the elderly, persons with disability, indigenous peoples, homeless, stateless, migrants, and under the Pumule, Prihatin, and Perkasa packages, only 80% of the 80 billion out of the 530 billion, only 15% are for direct fiscal injection, which is grossly inadequate to support businesses, workers, and households. The I-Lestari policy saw an acceleration of withdrawals, which left 42% of EPF contributors with less than 10,000 ringgit in account 1, and 62% are expected to have less than 10,000 in account 2. This depletion of savings poses serious challenges for their retirement. And the exclusion rate from social welfare aid is high. JKM itself has acknowledged that 34% of households did not get assistance even though they qualified for aid. And many poor people fall between the cracks. It is recommended that the social welfare system be revamped as it is inefficient and fragmented over 20 agencies. Database is incomplete and system of registration is not accessible and friendly to the really destitute. There's need to expand the social safety net for the self-employed and informal workers. And we need to create job opportunities, increase incentives to adopt new technologies, raise productivity and wages, reduce migrant workers, which depress local wages, and we need to promote entrepreneurship and to tap the potential of youth into the economy. We need to have balanced development, including regional, and to improve the provision of basic infrastructure and amenities, connectivity, affordable housing, quality education and health services, social protection, and service delivery mechanisms. And for nutrition, there are many gaps and challenges, but the two major challenges which require more decisive actions are in the stunting and underweight among children, which have increased from 13.7% in 2016 to 14.1% in 2019, and stunting has increased from 20.7% to 21% in 2019. And this occurred before the COVID pandemic and would have deteriorated further since. So it is very worrying that these two challenges have been increasing and not decreasing over the years. And the adult population also faces a malnutrition burden. About a quarter of women of reproductive age have anemia. About 11% of men and women have diabetes. 18% of women and 13% of men suffer from obesity, which give rise to non-communicable diseases, NCDs, which dominate the leading cause of premature death, 70%, and disability. NCDs reduce individual productivity and quality of life and unnecessarily raise health costs. And malnutrition among indigenous people is a serious concern. And the implications of malnutrition, stunting, and wasting is very serious. The effects on brain development are irreversible, adversely impacting their academic performance in school and not being able to secure decent employment as adults. The effects on physical development from stunting and wasting have this devastating impact on the potential of children to grow up as functioning and dignified members of the community. These will result in intergenerational poverty for the households, which will adversely impact efforts to eradicate poverty. And these will have long-term effect on human resource development for the country, especially with 1/3 or 20% of our children affected. And we need to have a holistic approach to nutritional improvements, starting from the crucial 1,000 days of life. We need to raise awareness and education on healthier eating habits among the population. And we need to address the availability of financial resources, which is the underlying determinant for nutritional outcomes. Long-term approaches such as income-generating activities are important for sustainable nutritional improvement. And we need to increase food production to reduce imports and ensure stable prices and facilitate access to affordable, nutritious foods. And Malaysia's food import bill has been rising rapidly, 6.5% a year, from 30 billion in 2010 to 50 billion in 2018. About 85% of the country's 8 million hectares of agricultural land are planted with oil palm and rubber. Only 8% is left for agro-food. However, about 120,000 hectares are abandoned by farmers. The cost of essentials have increased, where the prices of rice, eggs, and instant noodles rose by 40%, and the intake of vegetables and fruits have dropped by 40%. And in the investment in food production should not only be evaluated in terms of private benefits, but also social returns and the country's security. There is underinvestment in R&D in agriculture sector and inadequate extension services. We need to ensure that sufficient land is made available for food production, as well as to ensure the security of land tenure through establishing property rights for small-scale food producers or promote long-term rental contracts to encourage them to make investments to improve the land. And we can also encourage youth, skilled and professional labor force participation in modern agriculture. And way forward, we need to address the impact of COVID-19, which offers an opportunity for us to review past policies and to build back better. We have plenty of national policies and action plans, but are they properly implemented? Are the service delivery up to par? We need to adopt SDG 17 to strengthen the means of implementation, encourage and promote effective public-private sector and civil society partnership. We need to adopt a whole of nation or society approach, incorporating bottom-up considerations in order to develop in an integrated and holistic manner. And the key to success in operationalizing national policies, plans, and programs would be to internalize SDG 16 to promote peaceful, inclusive societies, promote access to justice for all, and build accountable and inclusive institutions at all levels, from federal, state, and local and community levels. And we need to ensure good governance, proper implementation, and effective delivery so that we will leave no one behind. Thank you, Madam Moderator.
Thank you very much. Next, can we have Professor Dr. Sulochana Nair? The floor is yours.
Thank you very much, Dr. Habiba, and thanks for this invitation. Good morning to all the way from Uzbekistan. This is like 7-something in the morning. Okay, Malaysia has undoubtedly made considerable strides in attaining the goals of the SDG with respect to poverty and nutrition. However, challenges continue to remain and persist, and it's important to analyze how these challenges can be addressed and overcome. I'll focus on several aspects of the SDG with respect to poverty. The second speaker had already focused on the poverty line. I share Tuan Williams' concerns about the poverty line, and as far as I'm concerned, with being a researcher in poverty for several years, the PLI is very limited in providing a true picture of the multi-dimensional nature of poverty. And the PLI, no matter how many times you revise it, how high you raise it, is still not going to give you a true reflection of the actual poverty and the realities of poverty on the ground. So the PLI, as far as I'm concerned, is a good starting point, but it should be only used as that, a starting point, and it should not be used as a criteria to provide aid to those in poverty, because those in poverty, there are several manifestations. A lack of incomes is only one manifestation of poverty, and there are several other manifestations which are equally important. So the true face of poverty is actually on the ground, whether it's rural, urban, regional, sectoral, and it can be seen at the grassroots level. And the nature, manifestations, and causes of poverty vary. And we cannot have a blanket approach to poverty eradication. This is where we are talking about targeted approaches, which are very important. So what I'm saying is that we should actually be less obsessed with the poverty line and move on and tackle the realities of poverty on the ground. My second point is with respect to the MPI. This is an improvement on the poverty, and it captures several dimensions. But one important dimension, which is a critical indicator and manifestation of poverty, is employment, whether it is in the formal sector or in the informal sector. And this is not captured at all in the MPI. So this is where the limitation and the MPI lies. And moving on to employment, I would like to say that COVID-19 and the SDGs, the SDGs have recognized that COVID-19 has ravaged the whole world, and Malaysia is no exception to this. What has happened in Malaysia is that about 16% of the workforce, my data may be a bit outdated, are in the informal sector. And the informal sector has been the one that has been seriously ravaged by the impact of COVID-19. And the informal sector is not just, it's got several components. It includes the gig economy, it includes the platform economy, it includes the domestic workers, it includes women men working from home, and several other aspects. So and there is no social protection, there are no employment contracts, there's no legal recognition of the informal sector. So Malaysia has to move in tandem with other developing countries and provide some kind of recognition for the informal sector, and of course include social protection. There are some strides that are commendable that have been made with respect to the informal sector, but this sector needs to receive critical attention, because both the urban sector and the rural sector have the informal sector as part of its economy. And it's very important that this sector is given, and many urban middle income households are also dependent on the informal sector for various goods and services. So this informal sector must be given adequate attention. And the other point that I want to make is that the COVID-19 has also affected the services sector. Services sector, especially the tourism, hospitality, and aviation sectors. And there is widening income inequality in the community as a result of COVID. And unemployment has increased among low-income urban families, and more families are pushed into poverty. So attention must be paid to this new poor, become a part of the fabric of our Malaysian society. And this is very important, that very rapid assessments are made on who these new poor are, and basically the causes of their poverty. And I cannot emphasize enough that having a poverty line is inadequate for this kind of an exercise. And also there is increase in underemployment. People are taking up jobs which are below their qualification, below their capability, and doing various jobs that are actually not being very productive in the jobs that they are on. The other thing that also the pandemic has exposed, and this is also related to employment, is the work from home. Everybody assumes that everyone can work from home. Certain jobs you cannot work from home. And even if you work from home, how many low-income households have adequate gadgets to work from home? They're competing with the children who require the same gadgets to access education. And if there are several kids, they need several gadgets. And this is a reality on the ground. And when you tell people to work from home, there is no infrastructure, there is no tools that are provided for people to work from home. And this has an impact on productivity. And if this is likely to be the new norm for the future, then some serious attention needs to be paid from equipping people to work productively from home. Another point I want to make is with respect to the what is the way okay, before I go on to the way forward, as far as nutrition is concerned, when the new poor come into the picture, they also require nutrition, and food parcels, food handouts, and all of this has been happening both by the government and by the NGO sector, as well as individuals are also providing food for various groups of people. But this has to go on. Children who received food from schools, which is a very important source of nutrition, have been deprived of this. And what has happened is that the nutritional status, malnutrition, stunting, and wasting, etc., would likely to increase with COVID-19. Another factor is, so what's the way forward? Okay, the way forward is basically to, I see two ways in which the government as well as society, whole of nature approach is very true. The first thing is, when we look at the SPV 2030, one of the key components of SPV 2030 is political stability. And I do not need to say any more about political stability. I think it's very obvious. And also, it is very inclusive. It is supposed to improve the standards of living of all Malaysians, etc., etc. So one of the things that has come out, okay, the COVID-19 has exposed cracks in the system, but at the same time, the COVID-19 has also given rise to many opportunities. One is the rise of the platform economy, the online food and other services that are provided online, as well as as well as other sectors that have cropped up as a result. Communities at the local level, at the grassroots level, have shown their resilience. And it's very important to leverage on communities. Communities did not let their members down. They showed resilience by sharing of resources. Another factor that is very important, and I will conclude with this point, is the role that social enterprises can play in addressing the challenges posed by the COVID-19, and as well as the same time bring together the SDGs. The social enterprises have come into the forefront by providing things like face masks, PPEs, food, educational resources, health, access to health, etc. And social enterprises can be leveraged on to provide solutions for the way forward for COVID-19. And in conclusion, and Malaysia has got several social enterprises. And in conclusion, what I want to say is that the SDGs must be integrated and aligned with the COVID-19 recovery plans. Otherwise, the SDGs are at a threat of being pushed to the back burner and being forgotten. So the VNR report and the government's involvement in the VNR report is a very good strategy. But at the same time, the efforts, there must be an integration and an incorporation of the SDGs into the COVID-19 recovery plans. And with that, Madam Chair, I will stop my presentation. I think I've taken up my 10 minutes.
Thank you very
Thank
much.
you.
Thank you, Professor Dr. Sulu. We have a few questions from our participants. If I may read them, and perhaps we can respond to some of these questions. Firstly, a huge food import bill and scarcity of land for food production were cited in your presentation. I think this presentation refers to Dr. Herman's presentation. How do we balance this with the food related exports, including palm oil for food Malaysia? Secondly, how will Malaysia navigate the policy of social safety net in the future? I think all four presenters touched upon social safety net. Third, will our social protection system safeguard the vulnerable community if another economic crisis in the next 5 years? The way forward for poverty eradication does not seem to employ the WOG and WOS approach. Any program to empower the poor through enabling economic activities for them? As the saying goes, give them the fishing rods, not the fish. So this is about empowering people. Will the government embark on nationwide integrated livestock farming system and closed loop systems to address land scarcity and high cost of animal feed? How are stateless children included in the work? Sorry, it's gone now. As for the B40 group, are the figures and reflection of all ethnic groups who are Malaysians? It's a little bit hanging, this question. I think there's a lot more. If we can take this few first, I guess the most relevant to you, definitely the one on expansion of social safety net has been touched upon by all. On food, on nutrition has also been touched, but these questions are a little bit more specific, but you may, if you would like to. So if I may let us respond in turn. If I may call upon Dr. Herman first.
Okay, thank you, Dr. Habibah, moderator. If I may respond to the question on issue on the social safety net, I think it was raised by Mr. Faris on the social safety net moving forward, and the other question would be on the how does social safety net provide us a platform to mitigate any crisis in the future. Well, at the moment, as I mentioned just now, we have a social safety net, but not in a coordinated way. We have the e-Kasih data system under the ICU, and we have e-Bantuan under the Jabatan Kebajikan Masyarakat, and then we have the cash transfer under the MOF. Presently, moving forward, this data will be integrated where under one single perlindungan data, perlindungan sosial, where we can access those who are vulnerable, those are registered, and those are in needs. So from time to time, those who are vulnerable and entitled will be registered to these systems. And our experience for the COVID-19 initially, we are lucky that some data on the BSH and some data on the BRIM are also already in place. So the cash transfer can be done through automatically through their banking system. For those who are unbanked, especially in remote areas, Sabah, Sarawak, they are mobile exercise by the respective state authorities and federal authorities to reach them. So moving forward, this integrated data will integrate the system of IKASI, e-bantuan, also from MOF. So anything happen in the future, we have the database in place, so we can refer it immediately. That's for the social safety net. So all the coordination, all the policies, implementation will be centralized under the My Social Protection Council, which already been established and going to be being activated. Thank you. On the question of the Mr. Faris of national on the balance between palm oil and food, and also on the livestock, this is will be on under the division, my other division of agriculture. But we at the moment those matters are being discussed at the committee for the food security, cabinet committee, and to formulate the national agri-food policy moving forward. So there will be a balance between the, as we know, our commodity, say palm oil and also rubber, one of our main exports. There is need to strike a balance between food and commodity for exports. So, but interestingly, due to the COVID-19, there are some private sectors, NGOs, and also communities, and also the Minister of Agriculture are encouraging the kebun community for the cash crops and their usage. And if you look at the, for example, Felda, they are already planting of the other land of cash crop, banana, pineapples, and moving forward probably to the crops like paddy. Yeah. So this is to balance between whatever we can produce at home to reduce the import bills, and also whatever we can export to gain income for the country. That's all at the moment. Thank you, Doctor.
Thank you very much. YB Tuan William, any comments from you?
Question on the social safety net. I agree with Dr. Herman that at the moment is fragmented, and if it can be consolidated not only among the ministries but also with the state government and also local government, then I think there is always more than enough for everyone to go around. The situation now is that you would find one person that may be receiving aid from 2 or 3 different sources, while some are totally left out because of the gaps in the data. So if we have a consolidated data of all the 3 levels of government plus the different ministries, then we would have a more effective social safety net. With regard to the question on the empowerment and the giving of the fishing rod, I think the empowerment is already there, the idea of the SDGs being localized. So once we proceed with the programs for the localization of the SDGs, where the programs and initiatives are proposed from the bottom up, then it will be a more effective way of providing the fishing rod that they need, not the fishing rod that the government thinks they need. Thank you.
Thank you. Dr. Lin?
Yes, regarding the social welfare system, we have so many programs, more than 120 programs implemented by more than 20 government agencies. And still, we are not delivering what should be delivered because there are so many that are left out. And JKM itself acknowledged that 34% of those who are eligible, who have applied and eligible, are not given any aid. And it is still based on the 980 ringgit poverty line. So there is so much to be done. We need really to evaluate all these 120 over programs, welfare programs, and see what works and what doesn't work, and consolidate them, and really make them accessible and friendly to those who are really destitute. The homeless, they don't have address, some don't have documents, some are ignorant of that there's aid available, and there's so many reasons why many fall between the cracks. And then we have pockets of dire poverty in PPR flats in urban areas where many are left out. One UN survey found that only 4% are given aid and 96% have been left out in PPR flats in some parts of KL. And then we have huge pockets of poverty in Sabah, Sarawak, Kelantan. In Sabah, we have three districts with more than 55% poverty and 4-5 other districts with more than 45% poverty rate. So how do we address all these, because if we look at aggregate numbers, it looks like everything is fine. But when you disaggregate and also disaggregate along the regional areas, the discrepancy, the inequality is enormous. That's why we really need to also go for, more balanced allocation of resources among all the regions in the country, because at the moment, about 41% of the GDP is generated from Selangor and KL. So a lot of resources are provided into these areas, whereas other states far away, besides Penang and Iskandar region, we have established other regional development bodies. We have state government, state development corporations, and so forth. But nothing is working for all these far-flung and depressed and less developed regions. So we really have to approach it both from the macro aspect as well as from the micro aspect. And also the delivery system is very, it leaves a lot to be desired. A lot of, checking of the validity of applications and so forth are done by daily paid workers. And even in JKM, you need to have professional social welfare qualified workers so that they can gauge when they go and visit households, what is really required for the household, and not only in terms of a cash injection, but they can see whether there are some disabled people, some are sick, some are mentally disabled. There are so many problems in the very poor families, and a well-qualified social welfare worker will be able to address this in a holistic manner instead of, one just go and give money, another goes and take care of the disabled, another goes. So the duplication among all the agencies are really very wasteful. So we really have to look back and revamp the whole system. And this pandemic really gives us the urgency to review, evaluate, and come up with new efficient programs and new efficient service delivery mechanisms. Thank you.
Thank you very much. Before I call upon Professor Dr. Sulo, there's one specific question addressed to you, which says, agree to Dr. Nair's point to engage the contributions of informal economy into the social safety net. I have a question to Dr. Nair. With regards to the need of improving food production, we know that a large number of smallholders and independent farmers are engaged in agriculture. Addressing their needs will be important to food security in Malaysia. One of their major concerns is lack of labor force and difficulty of migrant workers recruitment. Yet one of their recommendations is to reduce the numbers of migrant workers. Can you please elaborate your rationale? Also, how do smallholders benefit from the National's plan on poverty and food? Prof. Dr. Sulo, to you.
Okay, thank you. I will address the questions in the order in which they have been asked. First, it's the social safety net. Yes, it's very important for Malaysia to have a comprehensive social safety net that is long-term and sustainable. I agree with all the other panelists that that I think we have been talking about this for years, but it's high time to put it into practice, that we need a comprehensive social safety net that provides protection to vulnerable persons at the time of crisis. That's one. The second thing is empowerment of the poor. Yes, definitely there is a need to empower the poor by integrating them into the decision-making process, and at the same time, also capacity building at the grassroots level is very, very important. And I think in this case, you need to identify local champions from the area of the poverty groups who can be role models in the future for the poor. And if you go and stand there and say that you can become successful, the poor cannot relate to you. They need role models from their own group so that they can actually relate to so that they can actually aspire to improve themselves. The other point is that whether we should be giving fish or giving the fishing net, my concern is there are certain very groups to whom you have to give the fish, because even if you give the net, they are not in a position to actually do anything with the fishing net. So you have to give them the fish, and some groups require both some kind of handouts at the same time, also the capacity building and the tools to go and improve their income earning ability. The other another point, and I think this is a very important point, there must be attempts to encourage savings of households. Poor, low income, even if you put aside RM1 a day, it is still some saving, because a lot of studies have shown that households either have very low levels of savings or no savings at all. And if I remember from my own work in the field, we found that households had very low income levels but had very high expenditure. That indicates that there is a very high debt burden among households, especially in the urban area, and this needs to be tackled because they are borrowing from the Arong and whoever else, because the expenditure pattern and the income patterns do not gel. There's a wide gap between income and expenditure. And the final question on the informal sector and the smallholders. Of course, the smallholders are a group that are very close to my heart, because my whole research has been on rubber smallholders. But here, I think they're talking about food producers. Yes, it really breaks my heart when I saw pictures of the vegetable farmers from Cameron Highlands having to dump their vegetables when there are people in the country who are starving, especially during the COVID. And this is because of a lack of proper marketing facilities, a proper integration, and because vegetables and all are perishables. And there is no, I mean, there's very little attempt to do some processing of vegetables. So as far as the smallholders, the smallholders should be integrated into the national recovery plans, and smallholders across all sectors, including rubber, whether they're oil palm smallholders or whether they are vegetable and fruit farmers, they must be integrated into the national recovery plan, because everybody has been hit by the COVID-19, and there's no one who is spared. No one can say, I didn't have any impact on me or due to COVID-19. Everyone has been impacted. So these groups are this is where, again, the targeted approach that Malaysia used to have in the past for poverty eradication is still very relevant. If you go back to the new economic policy, a lot of the tenets of the new NEP, which says poverty eradication irrespective of race, it should be something that we should be strictly adhering to, and also a targeted approach. Because right now we need to target, there are pockets of poverty. We need to work with NGOs and other organizations, CSOs, who are actually dealing with these various targets of the poor, and use the data that they already have and build a national database. That is very important. Not go and collect the data all over again and waste resources. And of course, I agree totally with Dr. Lin that there are so many agencies dealing with poverty. There are so many agencies dealing with welfare and food handouts, food parcels, all kinds of welfare aid, health, education, and you name it. There must be integration. Otherwise, it just is duplication of functions and a wastage of scarce resources. Thank you, Madam Chair.
Thank you very much, Prof. We have very few time left. To wrap up, perhaps each and every one of you can provide what is the most important to you if we want to achieve our aim of no poverty and zero hunger. Perhaps not more than 1 minute. Datuk Herman?
Thank you, moderator. In relation to the question just now, moving forward, we should address poverty, inequality also. It's not only from the monetary terms alone, but also from the other multidimensional poverty dimension. For example, the level of education, the health, and also the standard of living. Furthermore, we also need to look into the ways, reason, and why poverty still happen. Is it from the supply side? Is it from the government? Is it from the NGOs? Is it private sector? Or we need to look at the poverty from the behavioral side. What behavioral contributes to poverty? That's we need to look at this point from supply and from the behavioral side. Thank you.
Thank you so much.
The rest would be maybe if you look at it presently in the draft Malaysia plan, we have some focus on addressing poverty and inequality, and on the specifically on the urban poor. YB Tuan William of MP Selayang has mentioned just now, urban poor. At the moment, the urban poor, though the percentage is lower than rural, but the numbers is higher. Dr. Lin also mentioned urban poor. There is a specific on the drafting RMK 12, and also moving forward on the orang asli. The minister just mentioned just now, and then also the other part of anak negeri Sabah and Sarawak. Dr. Lin mentioned just now, anak negeri Sabah and Sarawak. There will be a specific chapters and the and some on the allocation for that. And then we also concur with Prof. Sulong on the employment scheme for the uncovered. Yeah. So the rest would be in the I'm not in privy to discuss whatever in the Malaysia plan at the moment. We will wait and see, as mentioned by Dr. Zulika just now. We are just waiting for the government to notify us for the tabling at the parliament. Thank you.
Thank you so much. YB, if I may have a sentence from you, perhaps.
Thank you. I think the most important thing that we must not forget is we are looking at human development in all its aspects. So the capabilities approach is what the SDGs is all about. And if we approach it from that angle, what is required, the deprivation is not just pecuniary, it can also be non-pecuniary. And if we take that as the yardstick for human development, to give them the capabilities so that they can function to live a flourishing life. If we look at it from that point of view, then the rest of the SDGs and the rest of our programs fall into place. So if we all move along that direction, that has already been in the process since the 1990s, which should gather the momentum and work towards that target. Thank you.
Thank you so much. Dr. Lin, to you.
Yes. I think that on a macro level, there should be a more equitable distribution of allocation of resources to all regions of the country, and not to leave some really remote and neglected. We need to do all this in order to create industries, create production, and to increase employment, so that they don't have to all rush to the rural areas where they can't even get jobs as well. And there are a lot of social problems in the rural areas where youth are unemployed. In fact, the unemployment of youth is more like 15 or 16, now maybe 19%, because they are not registered under those who are actively looking for jobs. So because they have no employment, they are poor, there are many, many social problems. And in our APPG work, so far now, we have gone to about 20 over constituencies. And one of the main problem there is drugs, drug addicts among the youth. So it is a very serious problem, and we need to give them alternatives. They need to have jobs, they need to have income, they need to have a purpose in life. So, the balanced development in the whole country is very important. And then the other thing is on the service delivery. This has always been a very serious problem, and the government has allocated a lot of money in the budget, a lot of funds for every agency, ministry, for all kinds of purpose and so forth. But are all these resources, all these budget reaching the target groups? You know, that is a very serious thing to look into, because we find that many agencies are not performing well. And when we went down to the ground, we see that when we have town hall meetings with the communities and agencies and so forth, and we find that all the government agencies are working purely in silos. So nobody is connected to anybody else, you know. So this really is, we need a better and integrated and more holistic approach. And so service delivery is a very important area that we need to look into to improve. And the other thing on nutrition is that we really need to educate, raise awareness among the population on nutrition and food security. A lot of parents in poor areas, both are working, and then they'll just give some money to the children to go and buy whatever they like. So that's why even if they have money to buy food, they are not eating properly. So awareness and education is very important. And of course, the financial access to food, they need to have jobs, they need to, you know, to find employment in order to have access. And the government should also facilitate access to affordable, nutritious food.
Thank you so much. Prof. Dr. Sulo?
Okay, I've just got a few points. First, you need to formalize the informal sector. Second, you need to recognize the new poor. Third, you need to align the SDGs to COVID recovery plans. Fourth, you have to address inequality in income and wealth. This includes all kinds of inequality, regional, between the state, between urban, rural, etc. You need to focus on education and health, and education, especially education in education in schools, and also in the tertiary education, because the COVID-19 has disrupted the whole education system, and you need to make a lot of corrections in education. And because kids, especially from the urban low-income families, when you ask the parents why are your kids not using it, they said Skola Chuti, and they're at home, they think it's a holiday, an extended holiday for a long period. They don't realize that because the parents are not educated, they don't realize there are online classes, serious online classes. And finally, we need to go back to the SPV 2030 and adopt an inclusive whole of nation approach to raise the standard of living for all Malaysians. And I think this is very important. The SPV 2030 is a useful document to leverage on. And again, finally, in conclusion, I just want to say that the VNR report has done a very good job in terms of addressing many issues, but there are still gaps that need to be addressed and taken seriously. Thank you very much, Madam Chair.
Thank you very much, Prof. I think thank you to all panel speakers for your important insights as well as thoughts on Chapter 2 of the report, Poverty and Nutrition. I think we acknowledge that we have made significant progress in some of the targets of SDG 1 and 2, but not all is good. A lot more has to be done. And our speakers have highlighted some of these challenges and how we can move forward from understanding where we are now. Definitely, I think things that were covered includes even the definition of poverty itself, which needs to be properly defined so that it can be properly identified and addressed, up to the point of also integrating SDG to our recovery, as well as addressing our national development, moving from where we are, impact of COVID-19, having a more multiple, multi-dimensional, more targeted approach, more equitable distribution of resources as well as development. I think the issue of urban poverty was also raised, which needs specific interventions to understand as well as to address the issue. So thank you, everyone. I think it is a wonderful discussion, and hopefully what has been raised will help us move forward in terms of addressing issues and getting to where we want to be, no poverty and zero hunger. Thank you. Back to the MC.
Thank you so much, Dr. Habibah Abdul Rahim, for being our moderator for today. Thank you to all our panelists as well. Dr. Herman, we would like to thank YB Tuan William, Dr. Lin, and Professor Dr. Sulochana as well. Thank you so much for coming on board. Time is never enough to discuss all this as well. Everything is very insightful indeed. I think very importantly is human development. How are we going to move forward with this as well? And to empower our nation and our people as well, and to basically elevate our standards of living as well. I think that's so important. The education, the awareness, and also the development of human development as well. You know, in any businesses as well, it's always human capital that we need to invest in as well to make our nation great again. Thank you so much. All right. We have many questions coming in to all our participants. Thank you. Keep the questions coming in. Unfortunately, time is very short. We cannot answer all your questions, but do not despair. We will have a publication out for these two sessions in this next today and tomorrow as well. And we shall publish it and we shall address all your questions as well in it as well, and for all of you. So we shall take a very short break for maybe about 2 or 3 minutes for you to just maybe grab a glass of water and to do what you need to. And let's say at about 11:45, maybe 2 minutes should be quite adequate for now since we're all at home. 11:45, we shall start the final session for today, which will cover session 2, strengthening resiliency and transforming healthcare as well. And with that, we shall take a short break and come back in just a few moments. Have a great one, everybody.